And joining me now is Dr. Anthony Fauci. He's, of course, the director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, welcome back to Meet the Press. And I have to tell you, it feels like deja vu all over again, sir.
It sure does, Chuck. It sure does. This is a very difficult situation, and you described it very well.
Look, let me start with the CDC guidance and a bit of that confusion. And I say this, I know it's easy to backseat drive right now with Delta, but you were concerned about Delta in June. Obviously, the WHO was concerned about it in May. And yet, here you, in late June, you were saying you were feared that this was going to be the dominant strain and perhaps become a problem within a month. Well, here we are. But in that intervening days, there's been a ton of confusion from the CDC about when should we wear masks for the vaccinated, how transmissible is Delta among the vaccinated. Some of this has contributed, I think, to the frustration that we see out there today. Can we try to clear some of this up? How dangerous is this Delta variant for the vaccinated and the unvaccinated?
Well, it's extremely dangerous for the unvaccinated because if they get infected and if they stay unvaccinated and don't wear masks, ultimately they're going to wind up getting infected, and that's what we're concerned about. It is, as we've said, a pandemic and an outbreak of the unvaccinated. If you are vaccinated, you are very well protected against getting infected. Since no vaccine is 100% protective, there will be what we call breakthrough infections. That's the bad news. The good news is that almost invariably that will be an infection that is either without symptoms or minimally symptomatic, which means the vaccine still protects extremely well against severe disease leading to hospitalization and deaths. But the interesting and unfortunate thing that we found out that gets to the mask issue is that this virus is so easily transmissible that if a vaccinated person gets a breakthrough infection, which will happen, Chuck, you can expect that because no vaccine is 100% effective. Back when we were dealing with the Alpha variant, the level of virus was very low in the nasopharynx of a vaccinated person if they got infected. Now we're finding that the level of virus is really quite high, which means one of the bad things about all of this is that even though you're protected from getting severe disease, if you're infected, you can transmit it to someone else, even if you're vaccinated. And that's the fundamental basis of now saying people should be wearing masks in indoor public places when you're in a region that has a high level of infection.
How much of this CDC guidance change is come from the fact that we're not doing enough surveillance? Are we doing enough testing of the vaccinated? I mean, it seems now I think some people wish we had been, instead of doing what we had in Provincetown, that maybe we should have more testing of the vaccinated so we can know more about these breakthrough cases. Do you have enough data as a scientist to know for sure what these breakthrough cases are doing to people?
Well, previously we didn't. We'd have to admit that early on it was said to just give testing for people who've had contact with people who were infected, who were symptomatic. Now it's very clear you got to go beyond that, Chuck, because we know now from experience here and in other countries that you will have people who are asymptomatic who get into contact with an asymptomatic person who's infected, and you'll know that there will be more infections that otherwise would have gone undetected. So you're quite right. We need to do more testing.
Let's go with what the next month's going to look like. You seem to have a dire picture. You expect we're at 118,000 cases today of the 7-day average. You're expecting it to hit to 200. Our peak was 256, according to our data. This is pre-vaccine. I mean, this seems to be not only are we back to square one, but where does this lead us for the next 3 months? Are we going to have an even worse fall and winter?
Well, Chuck, there are two really serious aspects about this. As we've said all along, this is fundamentally an outbreak, a pandemic among the unvaccinated. That is proven true. You said that in the lead-in to the show. No doubt about that. One of the problems of that is you don't want people to get sick and to get hospitalized and to die. And that is actually happening now predominantly, overwhelmingly predominantly among the unvaccinated. But there's another aspect to that that concerns us in the public health sector when you have the dynamics of virus that continues to have the virus circulate in the community, as we're seeing mostly in unvaccinated parts of the country, usually the southern states, as you mentioned. What happens if you allow the virus to freely circulate? There's a tenet that everybody knows in virology. A virus will not mutate unless you allow it to replicate. So if you allow the virus to freely circulate and not try and stop it, sooner or later there is a likelihood that you will get another variant that could, I'm not saying it will, that could be more problematic than the Delta. Fortunately for us, the vaccines do quite well against Delta, particularly in protecting you from severe disease. But if you give the virus a chance to continue to change, you're leading to a vulnerability that we might get a worse variant, and then that will impact not only the unvaccinated, that will impact the vaccinated, because that variant could evade the protection of the vaccine. So people who are unvaccinated should think about their own health, that of their family, but also the community responsibility to crush this virus before it becomes even worse.
You've brought up regionally the South, but out in the plains, in the Great Plains, we have Sturgis, South Dakota. There's a gathering right now of some 700,000 people. Last year, it was a smaller turnout, and it was over about 150,000 people, and it led to a massive outbreak in the Dakotas, where they became number one and number two for essentially the rest of the calendar year of cases. What do you expect this rally to do to that part of the country?
Well, I'm very concerned, Chuck, that we're going to see another surge related to that rally. I mean, to me, it's understandable that people want to do the kinds of things they want to do. They want their freedom to do that. But there comes a time when you're dealing with a public health crisis that could involve you, your family, and everyone else, that something supersedes that need to do exactly what you want to do. I mean, you're going to ultimately be able to do that in the future, but let's get this pandemic under control before we start acting like nothing is going on. I mean, something bad is going on. I mean, we've got to realize that.
Vaccine mandates, we know the government isn't going to do vaccine mandates, but are you going to attempt to create the conditions to allow private businesses and other entities to do vaccine mandates? Is that sort of the next phase of what the federal response can do?
Absolutely, Chuck. As you know, and I've said it several times on your show, that you're not going to see a from the federal government mandating vaccines for the country. But I'm almost certain, in fact, I am certain, that as soon as the FDA fully approves the vaccines that are now under emergency use authorization.
When is that?
You know, Chuck, no one wants to get ahead of the FDA because they're an independent group that makes their decisions, and that's good in many respects because there will never be any concern that we're influencing them. But I hope, I don't predict, but I hope that it will be within the next few weeks. I hope it's within the month of August. If that's the case, you're going to see the empowerment of local enterprises giving mandates. That could be colleges, universities, places of business, a whole variety, and I strongly support that. The time has come is we've got to go the extra step to get people vaccinated. You want to persuade them, that's good, and I believe that some people on their own, once it gets approved as a full approval, will go ahead and get vaccinated. But for those who do not want, I believe mandates at the local level need to be done.
I want to go through a couple of myths that are out there about the virus. First of all, and this is among people that don't want to get vaccinated, and I want to play some sound for you of some folks explaining why they haven't gotten vaccinated. Take a listen.
No, I have not been vaccinated. I have had COVID, as he had last winter.
I had it already. I kicked his butt.
That seems to be, I've heard this frankly, from friends and family in my circle. Oh, I've had COVID. I don't need the vaccine yet. What do you say?
Well, there have been recent studies that clearly show that if you've had COVID, you might be protected for a while against the original virus that you were infected with. But when variants come along, you are vulnerable. And there was a study that came out within this past week that showed that if you are infected, recover, and get one shot of the vaccine, your protection doubles what it would be if you got 2 shots of the vaccine and were not infected. So it is a major advantage for people who have been infected and recovered to really strongly protect them against getting reinfected with a new variant. That's the reason why we strongly recommend that even if you have been infected, that you get vaccinated.
Let me get another myth, and we've actually heard this from some healthcare workers who are being resistant to getting the vaccine, which is, well, I wear a mask and I keep myself healthy. I use all the sanitation that there is, and I'm very careful. I don't need to get vaccinated. What do you say?
Well, I think just the reality, Chuck, and history proves that wrong. There are people who have tried their best, put masks on, washed their hands. This is a very, very transmissible virus. The best protection is getting vaccinated. There's no doubt about that.
Either way, should there be a vaccine mandate for all healthcare workers? I have to tell you, it seems almost irrational that we don't have a vaccine mandate in senior homes. Okay, the idea that that isn't there. And I understand what you said, and there's some talk of using sort of a federal funds to almost coerce some of these folks. But, you're a leading person in the medical community. Can you imagine having anybody that works in the medical community refusing the vaccine?
It happens, but that is amazing. It's inexplicable to me. You are a healthcare worker. Your profession, the thing you've devoted your life to, is to protect people, to make them well, to protect them from disease. But Chuck, this is not something that's new. I mean, I see patients at the NIH Clinical Center. If I don't get flu vaccine or hepatitis vaccine, I'm not allowed to see patients. So this isn't something that's brand new with COVID. So I'm very much in favor of mandating, if you want to see patients and you want to participate in health care, you need to get vaccinated, period.
I want to talk about boosters, particularly there's a lot of folks over the age of 60 watching. They are hitting their 6-month mark. What do you tell them right now? They've been saying, there's a lot of noise out there that says they're probably going to need a booster. Considering this Delta variant, some of them may go out there and just go get one anyway. What would you say to someone watching right now who's wondering if they should get this booster because they've hit their 6-month anniversary?
Yeah. Well, Chuck, first, for the clarity of our view, is something sometimes get confused. If you're a person who has an immune compromise, transplant, cancer chemotherapy, immunosuppressive therapy, you likely never got a good response to begin with. So it isn't that the durability of the response went down. For those individuals, I am strongly in favor of getting them that additional shot as soon as possible. Then you get to your question, which is the elderly and others. There's no doubt that over time, you're going to have an attenuation of protection. If you look at the data from Pfizer shows it went down from the 90s down to around 84 after a few months. The recent data from Moderna shows that it isn't really going down, but everyone assumes, and I think correctly, that sooner or later you're going to see an attenuation to the point where we're going to have to give an additional boost to people, very likely the elderly, before you give it to otherwise normal people who are not old. That's going to happen as soon as the data gets to us, and we're following it on a weekly basis. As soon as it looks like it's getting down below a critical point, then we're going to get the vaccines for those individuals. So
they may get a booster. Kids 12 and under have yet to get any vaccine, and we're seeing an alarming number of hospitalizations now, particularly in children's hospitals. We're seeing it down in Florida for sure. How concerned are you about this? And is this we had a lot of semi-comfort that, hey, if kids got COVID, they were going to be okay. That doesn't seem to be the case now.
No, it's not. And that's something that we've been saying all along, where others have said, no problem with children. There is a problem with children. You've got to separate and make sure you get the facts. The likelihood of a child getting serious disease compared to an elderly person or someone with an underlying condition is absolutely less. But less doesn't mean zero. And there are a lot of children now. All you need to do is do a survey of the pediatric hospitals throughout the country, and you're seeing a considerable number of young people who are not only infected, but who are seriously ill. Again, the numbers compared to the elderly are less, but that's a false comparison. These kids are getting sick. We've really got to make sure we protect them.
Can you imagine an elementary school anywhere that didn't have a mask mandate, considering what we're seeing right now with kids under 12? I know the politics of it, but leave that out of it. Just with what you're seeing on the scientific basis.
Yeah, there's no doubt about that in my mind. There are two things you do with children who are not vaccinated, and that's the recommendation. You surround them with those who can be vaccinated, whoever they are, teachers, personnel in the school, anyone, get them vaccinated. So protect the kids with a shield of vaccinated people. For the kids who can't get vaccinated, that's the reason why we're having a strong recommendation that in the schools, everybody should wear a mask, whether or not you're vaccinated. We've got to protect the children, Chuck.
Well, and that's a topic that we're about to tackle even more in depth in a few minutes. Dr. Anthony Fauci, as always, sir, appreciate you coming on and sharing your expertise with us.
Thank you, Chuck. Thank you for having me.
Hey, thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.